I'm just going to start with the waiver work, and we don't have a screen for that. So I would like to first invite everybody and say thank you for joining us for our Justice Involved Collaborative for February 2023. We have 2 topics today, and you'll see the screen for one of our topics up. This is the first slide of a presentation from Amanda Braxton. Amanda will introduce herself in a minute, but she was here a few months ago to talk about a project that she's working on for next day CCO enrollment, which is very exciting. And we have also had Katie Beck, who has been with us in the past, and she has talked about the 1115 waiver work. It's actually called the 1115 demonstration waiver. And that is a process where every 5 years, we get to ask the federal government for a waiver so that we can do things a little bit differently and be innovative with how we organize our programs and how we deliver our programs in order to better serve Oregonians. So we are currently in a once every 5-year process to ask the federal government for special permissions. And there are some permissions we have asked for that directly impact the carceral community and those releasing from incarceration, those who are incarcerated and releasing. And these 2 projects interface. And so what we're going to do today is first we're going to have Katie Beck introduce herself and talk to us and remind us about these waiver provisions or these waiver asks that will impact this community. And then we're going to have Amanda talk about the next day CCO enrollment. And that is going to, your brains are going to explode. But I think what you're going to all find is that these are exciting things that are coming along, and there are some questions that you're going to have about how they interface. We have anticipated some of those questions, and so Amanda will try to answer some of them up front, but we expect you will have more. And so we have 3 people here to both present and then also answer your questions. So Amanda, if you can give a short introduction to yourself, that would be great. Then Katie, then Christy Taylor, and then we'll go into Katie's waiver explanation.
Sounds good. And I drink black coffee because I'm trying to get off sugar instead of caffeine. And the role I play in this setting is Katie and I have been communicating, quite a bit the last 2 years over the carceral population and some of the projects around that. And then I fell into this next day enrollment project as a project lead because of some of the work I was doing with Katie. So I deal with a lot of logging issues and meeting with people about issues, and some of those are to do with the carceral population. So that's how I got here today.
Thank you very much. Katie, do you mind saying hello?
Sure. Good morning. My name is Katie Beck. I'm a senior Medicaid operations and policy analyst focusing on transitions of care. My body of work for the last year has been the 1115 Medicaid demonstration waiver, securing the health-related social needs authorities from the federal government, and continuing to work on securing the authorities for the Medicaid and carceral settings requests that we have through the waiver.
Thank you. And we also have Christy Taylor here from our policy team just to answer any questions that might come up that are in her realm. Christy, do you mind saying hello?
Hello, everyone. This is Christy Taylor. I am a Magi Medical Eligibility Policy. That's a very long, very long title, but glad to be here.
Thank you. And I'm Deanna Simon. I'm with the Community Partner Outreach Program, and I love the people I work with, and I'm so happy to have Amanda and Katie and Christy here. They are amazing contributors making a huge difference for Oregonians, and I think we'll have a robust discussion today. So with that, I will in a moment turn off my camera since I won't be speaking, and I will hand it over to Katie to remind us about the pieces of this waiver that are going to most impact those releasing from custody.
Sounds good. So we have 3 primary requests on our 1115 Medicaid demonstration waiver, and I'm going to touch on the one that was approved first. So in September of 2022, we received the CMS approval to move forward with the health-related social needs benefit package. Among other populations, this provides some services to individuals coming out of carceral settings. And so when a person is leaving a carceral setting, there will be a screening to see what their individual needs are, and it will provide some supports for housing, like rental assistance up to 6 months, utility payments, deposits, help filling out applications for housing. If they need to secure proof of identity documents, it's help with that, payment for the fees that are associated with that. If they have a place to go, but it is not fit for them. So, for example, we have a lot of aging individuals coming out of our carceral settings. So, if they environmental remediations, those are services that would be covered in the package. Tenancy and pre-tenancy supports. It's great that we can get somebody into a house or an apartment, but how do they sustain it? How do they become a good tenant? And the other piece of that is nutrition benefits. So helping people identify what their local resources are for food banks or food pantries, nutrition education and pantry stocking, fruit and veggie prescriptions or healthy meal boxes, medically tailored meals, and assistance, filling out the applications for the Supplemental Nutrition Assistance Program, or women, infants, and children's programs. So it just kind of supports navigating those systems as well. That benefit, we received authority from CMS on September 28th of 2022, and we're in the implementation planning for that benefit. It will become available in a phased rollout starting in 2022. No, 2024, wrong year. It's a pretty significant lift. It's a big change to how our systems you work with providers or community-based organizations. So I would temper excitement as we look into 2024 coming up, and recognize that it's not going to be all at once on January 1st. It'll probably start with some housing supports for homeless populations and then build up from there.
And Katie, I got your message a little late there that you had some slides that might support what you're talking about. So if you want to guide me here.
Okay. So if you want to just jump to slide 10, and we can share the rest of this with folks as a follow-up if you'd like. It's content on what the waiver is, which I think Deanna kind of spoke about, and who we've collaborated with throughout the development of our waiver request, and as we're still in negotiations, so it gives you a little insight into that. So the pieces of the waiver that we're still in negotiations on are the request for Medicaid coverage in carceral settings, and we have two primary requests for that. One is a full Medicaid eligibility coverage, and the other is a limited 90-day benefit. So I'll speak a little bit about what we requested and then kind of where we're at right now in the negotiations process. So for the full Medicaid eligibility, we were requesting to no longer be required to suspend Medicaid eligibility when somebody is going into a carceral setting, but leave it ongoing for the duration of their stay in a local detention local juvenile detention, county jails, tribal jail. The point that we're at in negotiations with CMS is where, how do I say this? We're probably not going to get the full Medicaid benefit. It's looking like they're definitely interested in providing a limited, having, you know, 2 different benefit packages, whether you're in DOC or in a county jail. It's probably going to look pretty similar. So if you can move to the next slide, I think that this is a lot closer to where we're actually going to end up. So for this limited OHP transitional care coordination benefit, this was initially requested for the Department of Corrections, individuals at the state hospital, or in OYA closed custody corrections. CMS seems much more willing to engage on these coverage components for all carceral settings, as opposed to a full Medicaid benefit for all carceral settings. This would still be a huge win for us to be able to implement this and provide some support to our partners, you know, particularly in county jails where they're limited to a county budget. So this would provide increased OHP application assistance, pre-release, and discharge support. So when somebody's coming into a jail, it would provide that connection to their prior CCO, so that the jail is getting some advance notice of what a person's prescriptions are, what their healthcare needs are, and some coordination along those lines. And then as well, when they're leaving that carceral facility, that they would also be having somebody to kind of hand off anything that they may have done while they were in jail. So there's coordination there. You know, one of the things that we hear, or that I've heard from our partners in the law enforcement system, is that they don't have reliable information about a person's healthcare needs, and it causes some, you know, decompensation and escalation that would otherwise be avoidable if we had a better system of relaying information and some support. So this would also provide screenings and assessments for behavioral health needs, drug and alcohol screenings, social determinants of health screenings. So that would lead into the health-related social needs benefit package that I just spoke about. We are requesting, so this deviates a little bit, but at this point in negotiations, we're requesting to be able to provide prescription coverage for the county and local carceral systems. CMS hasn't said no yet, so we're moving forward with that part of the in negotiations, which is pretty exciting. I think that if we're able to provide that, it could alleviate a pretty unpredictable financial strain on the county carceral systems. For Department of Corrections, we're looking at increasing their prescription medication as they leave the setting, as opposed to providing the prescription coverage for the duration of their stay. And the reason for that is that the Department of Corrections and state hospital and OIA are all state funded as opposed to being county funded. So we have a little more flexibility in resources. The other thing is medication assisted treatment in all carceral settings is huge interest to CMS. They've really stressed throughout negotiations that that is something that is very important to them to see, which is great. It's fantastic. It's a huge lift to actually implement that statewide. But I think it's exciting to see CMS engage in these conversations very actively. What we saw with California, they were ahead of us in line. They submitted their application before us. for the waiver. They just got their waiver approved 2 weeks ago. And in reading through what was in their standard terms and conditions, it doesn't look like there's anything that was stated to them that would create a barrier in our obtaining what we've requested. It's not a direct one-to-one match, but it is similar enough that there's a lot of optimism and energy around that.
So, Katie, I just want to make sure that I understand correctly and folks are following. We have requested a bunch of provisions or a bunch of permissions that the feds or CMS is saying yes, but, and really scaling, kind of looking at the limited benefit package to potentially be available to all with some extra pieces that you mentioned there. And we're still in negotiations. We don't know. But because of the California approval, it's looking good.
Yeah. Yes. You summed it up perfectly. I don't have a ETA on when we're going to wrap up negotiations with CMS. It is entirely in their court. Hoping to find out soon what state gets to come up next after California.
Can you say again, there were 2 extra things that are being discussed with CMS that aren't on this slide.
Medication-assisted treatment.
And I'm wondering if I should actually close out this slide a little bit and add them. Would you mind if I do that?
Nope, not at all.
Okay, it's just partially a visual and so we can track it, but
sure.
So that would be medically assisted treatment.
Medication. Yeah.
I think medication assisted treatment while incarcerated.
Yeah.
And what was the other one?
Prescription coverage.
While incarcerated. Correct?
While incarcerated in a county or local setting. Not in DOC or state hospital or OYA.
Great, thank you. Okay.
And we can skip over this one. I started there. Actually, I think I've covered everything in those slides now. So the slides can go out just for informational reference afterwards if you'd like, but I think we've covered all the content in them.
Great. And really, this was not intended to be a full waiver discussion. It was a reminder about some of the waiver requests so that we can remember as we go into listening to Amanda's presentation what is also at play. And there, let's see. I think there is something that you mentioned, Katie, that I would like to ask about.
Sure.
If you don't mind.
Go for it.
You talk about more access to application assisters. And I'm wondering if you can say more about that at this time,
Sure.
or if not, we understand too.
So we know that application assisters are a valuable asset to people. Our process isn't easy. It's not a low barrier process. So having somebody to walk you through the application process is immensely valuable, particularly when you are in a state of trauma and upheaval, such as being carcerally involved or releasing from prison. Those are pretty significant points in life. We do not have a large volume or universal availability of application assisters that are
right. They're not at every
facilities.
facility. Yeah, it's not 100% coverage across the state, for sure.
So that's that is that's a pain point that we need to figure out a way to address that need. And you know, with this, everything takes time, it takes funding. So the reality is that whatever we get approved from CMS will likely not start prior to 2025 in terms of the Medicaid coverage in carceral settings, which gives us time to go through another legislative session to request, you know, policy option package for funding to meet the needs of the statewide community. Did that kind of speak a little bit to what you were asking about, or are there other questions?
No, thank you. That is helpful. And I have one more question that's from the questions box here. I think it's referring to the assessments and screenings for behavioral health needs. That third bullet, the question is if we have a sense of how, like, who would be doing those screenings? Is that presume medical providers, or if you can say more about that?
Sure. So at a nuanced level, it's a big to be determined. At a high level, individuals will be enrolled in their CCO. So, you know, it could be the coordinated care organization may choose to work out a deal with the jail or Department of Corrections where they're just accepting the assessments that are done there, or they may choose to have a provider go in, or they may choose to have their intensive care managers do the assessments themselves.
Okay.
We're still in implementation for that benefit plan, so a lot of those things are still getting, you know, fleshed out.
Okay. But covering those assessments and screenings to be covered by Medicaid while the individual is still incarcerated, so they can get queued up and ready to be receiving services upon release.
Yeah.
Great.
Yep.
Thank you.
Thanks.
Terrific. Are there any other questions for, I mean, I'm sure people have lots of questions about the waiver. But is there anything else that you feel like you need to know right now for big picture before we talk about next day CCO enrollment and we start to put our brains in gear about how these two interface? Right. I don't see any other questions, but of course people can type them in. Let's see if I can interpret this one. So the waiver, the provision is really, and this is to address the question in the questions box. The waiver provision is to provide coverage for up to 90 days before release. Is that correct?
Yes.
Okay, so if somebody was, for example, in a local county jail for 1 month, 30 days, the idea is that, would the idea there be that their coverage would not be suspended?
Correct. Yeah.
Okay, but
we're
if they
still
were,
we're still at a point in negotiations with CMS where we're doing that kind of push and pull dance. Our request initially was for, you know, the Department of Corrections, Oregon Youth Authority, and State Hospital, where we know that they stay for a set predictable amount of time, that we would still suspend, and then up to 90 days before release, we would initiate, you know, this new limited benefit package. Our request for jails, for county jails, juvenile detention, tribal jail, is to not suspend and have the duration of stay remain with open Medicaid coverage. It is less predictable in terms of the amount of time that an individual will stay in those settings. So we are kind of in that dance with CMS around whether 90 days is or is not appropriate. We're still pushing for the full duration of stay based on, you know, averaging, and
okay,
we'll see what comes out of that.
okay. Thank you very much.
Mm-hmm.
All right, with that, I think we're going to switch gears here over to Amanda.
Thank you, Deanna. So I wanted to start with why I asked Deanna to come here. A few months ago, I asked. We've been in contact quite a bit since this project was given to me for the next day enrollment. I was part of those initial discussions with the Justice Involved group about speeding up the enrollment to help with the carceral population. So I thought maybe just closing the loop. Now we're not in that space in the project where we have made a bunch of decisions yet. We're exploring things with our partners and internally, externally. We're starting to understand what our capabilities are to do next day enrollment. So what I want to say is I want to be open about the discussion and what we're doing, but the decisions haven't been made yet. Where we really just started doing the technical part here in January. So I'm coming to all of you at the beginning really of the project of really not implementing, but discussing implementation plans. So a lot of things, just like with the waiver, a lot of things are up in the air. The balls haven't landed so we can make the appropriate decisions, but I want to continue engaging all of you as that happens. So, and then because of the Justice Involved populations that you all work with, I was engaging Katie for this presentation because I'm really making it more focused on that, which is related to the waiver. So I want to go over the improvement overview for this particular project and talk about the proposed timeline, knowing that there's a lot of things up in the air and we haven't made any decisions yet. But knowing that number 3, questions and answers, is really in Katie's realm. That I've been talking to Katie over the last couple of months about some of the questions that Deanna brought forward, and I've been documenting the answers and the questions over the last couple of months. So Katie will probably be coming back in to kind of clarify, because some of these answers I got like a month or 2 ago. So if you can go to the next slide, Deanna.
Sure. There we go.
So what we wanted to do from the very beginning, we started having these discussions around end of September, October. I mean, we've had these discussions for years, but we started really prioritizing the discussions, is to prove access to needed healthcare and care coordination services, not just for this population, the carceral population, but for all the Medicaid populations. So by enrolling newer transitioning members to CCOs more quickly. So currently it's on a weekly enrollment cycle. And now the systems are still going to be the same. The rules are still going to be the same. We're just taking what exists now and speeding it up to next day. And we talked about next day in general early on, but now we're talking about next business day because there are limitations where we want CCOs to be notified of what their assignments are, so that there's not this back and forth of, well, they're not our member, they're not on our roster. So what we identified in the last couple of weeks, I mean, we identified this early on, but what we solidified is that some of our constraints is timely notifications to CCOs on our end through our technology. And also, this is kind of the unknown, timely notifications to CCO providers. So we're going to start engaging CCOs to find out what their limitations are, because we now understand what our limitations are. So overall, we want to move from weekly to next day. That's our goal, and with some limitations. If you can go on the next slide. And like I said, I came here today to talk about the adults released from custody and how that would speeding up the enrollment would improve access to transport medications and treatment facilities. But I also want to be very open in that we are evaluating. I wasn't fully, didn't fully understand MMIS's limitations, but I did understand that maybe CCOs had limitations. So we're talking about next day. But because of our limitations of notifying them the next day, and then possibly their limitations, it might be 1 to 2 days out. And that could impact some of the things that all of you may have been looking forward to, like NEMT and pharmacy, which was where that waiver questions are connected, how having these two projects come together. I at least could improve for future for this population. If you can go to the next slide. So here's kind of the questions that I've been gathering from Deanna and some other stakeholders and partners. And I was going to Katie and others for to get the answers to these, because I do not work directly with the waiver or this population. So is the DOC currently enrolling inmates into OHP 30 days prior to release, just not activating? And as Katie had confirmed, no, they are only submitting the paperwork 30 days prior. It can't occur at this moment until the Medicaid start date. And then for those released inmates that are getting restored benefits through the form, would they get next day enrollment once this change is implemented? Yes, regardless of what, depending on how the project plays out, their enrollment would start or restart depending on the Medicaid eligibility date in MMIS. And then as I was kind of thinking through this problem and the audience that's here today, I also put a note in last minute to prevent further delays. It would be nice that if that form or whatever mechanism you do to enroll your individuals, recommend selecting a CCO within the service area that they're being released to.
Can I just jump in on that one, Amanda,
Yep.
real quick? This 7100 doesn't currently contain a CCO choice box at all. So, but as a caveat and an update to the group, I am working on updating the form with some slight text edits, changing, anyway, just some slight text edits, but also to add a CCO choice. The caveat here, and we're probably going to say this like 80 times, but it has to be member choice. The CCO, if a CCO is selected, it cannot be by a provider, a facility, or a community partner alone. It has to be the member. So who's aware and willing to make that choice, making that choice for themselves. So that's it. We'll add it. We're getting it added. Our publications team, who helps us update the forms, is really behind in some projects, and so I'm not yet sure what the time frame is for an updated 7100, but we are working on it. So once that's in place, if the member has a choice, you will be able to select a CCO on there, and if not, then they fall into automated assignment and would follow the same time frames for enrollment either way.
And Christy, if we're going to be updating the 7100, is there an opportunity? There's different ways to go about these updates, but I'm wondering if there are opportunities for input to identify any other pain points on the form, or if we should talk about that later.
Sure, I'm very open and willing to hear input. I want to know if there are pain points, and I can also share the updates that we're thinking about. Probably not right this second.
Yeah, not right now. Yep.
But
we can create a separate space for that.
Certainly. Yep.
Great. All right, and we have more questions about that, which we're going to save either for the end or for a different discussion. And we're going to stay on topic. So I apologize for ignoring comments about that in the chat box, but I'm going to move it back to Amanda and make sure that we don't drop those.
I did not know that that was going to be a whole other discussion when I mentioned that last minute note. So thank you. I'm glad I mentioned it though, because I didn't understand the challenges. How would the next day enrollment impact those being released into an SUD or other inpatient care? This change request will not change this process. And then I'm going to be further having discussions further with other people about it. But it doesn't change the systems or rules. And next slide.
Yeah, before we go to the next slide, or while we're going to the next slide, I think that for me, the question here is, in the universe when the waiver, let's say the waiver provisions are in place and we can keep some level of coverage, limited coverage, while incarcerated, or at least through the last 90 days of incarceration. I might have said that wrong, but coverage for the last 90 days of custody. And then if that's the case, when someone releases, would they still need to wait a day or two for that CCO enrollment, or would there be a way to marry those two processes so that that individual could have CCO enrollment at release?
Katie, do you want to answer that?
Oh, and that I did actually have, that's the question that I posed to you, which you put into the slide. So we can
Okay.
I'll let you get there.
Okay.
I apologize. You're ahead of me.
So one of the other questions that Deanna had presented to me was, so when we discussed the limitations for CCOs, are there system communication solutions being investigated allowed next day instead of next day? That meaning allowing for that quicker notifications to, let's say, the NEMT providers or the pharmacies. And we don't know the answers to that. We have to engage the CCOs to discuss what their limitations are at this point. So that'll be happening over the next 12 months or so. And then I just want to be open about our limitations. It's not just the CCOs. Currently, with the weekly enrollment, it takes about 17 hours to create that assignment roster. And so we're wanting it to, speed it up to 10, 12 hours. And so now we're trying to figure out how to do that. And I'm not sure if that's going to be solved in a year. Actually, I know it's probably likely not going to be solved in a year, but we'll have those discussions about maybe phasing in. And then these are the questions that Deanna had presented that I was going to reach out to Katie after this presentation, but now that Katie's here, I hate to put you on the spot, Katie, but these are two questions that I was going to follow up on.
Okay. Sorry, I was multitasking. The last two bullets here?
Yeah. Mm-hmm. Yeah.
Okay.
And you want me to read it? If
Sure.
the waiver requests are granted and the adults in custody have coverage while incarcerated, will they be able to be enrolled in a CCO on the day of release? If so, will they be on a CCO for inpatient treatment upon release?
Yeah. So our intent is to enroll them in the CCO while they're incarcerated or maintain their enrollment. So once their Medicaid eligibility starts, their CCO will start as soon as we're able to auto assign them. So by nature of being in the CCO when they're releasing from the carceral setting, the current barriers around access to substance use, like residential substance use treatment, while on open card, that 24-hour period or so, will no longer be an issue for OHP eligible individuals. Does that make sense? Does that answer your question?
I definitely think it answered my question. So if in the universe where the waiver provisions or the waiver requests are in place and next day CCO enrollment is in place, because that CCO enrollment will happen while incarcerated, there will not be that rough transition for people releasing. They will be enrolled in CCO at the time of release.
Yeah. Yeah.
And that's way down the line, right? It's not happening next month or even next year. We're probably talking 2025 probably, maybe.
Yeah.
Until both of those line up.
Yep.
But at least we know that there's a point in time, and if the waiver provisions are granted, that we have this to look forward to.
Yeah. Thank you for being clear about the win.
Yeah.
I think probably everybody on this call is acutely aware of the difficulty that the current structure creates for individuals coming out of carceral settings.
And then that leads to the next question about NEMT access and how, as these things align, how would that impact the NEMT access?
So NEMT will still be a Medicaid covered service. However, the the NEMT service will follow the, how do I say this? Well, the individuals in the carceral setting, their health care is primarily provided by that carceral setting. So Medicaid will be a payer for prescription services, for MAT services, and NEMT would appropriately follow any of those needs.
And can I define the acronym? It's non-emergent or non-emergency medical transportation.
Thank you.
So what I understand then is if the waiver requests are granted and people are enrolled in their CCO while still incarcerated, even though they don't have a full benefit package, that on the day of release, they will be able to use the CCO transport company or brokerage.
For health-related services, yes.
Right.
It wouldn't, I mean, the NEMT wouldn't be an appropriate resource for getting from the jail to their living situation.
Right, but if they were going from the jail, and this is not uncommon, right? The jail directly to perhaps, mental health or substance use treatment, then that was covered by OHP, then the NEMT could transport them from their facility to that covered treatment.
Yes, with the caveat that NEMT has to be scheduled in advance.
Right.
And people don't, like, particularly from county or local jails, there's not always advance notice that a person is going to be walking out the door. So that'll be a hurdle for us to work through when that's the case.
Thank you for that. Yes.
Yeah.
Limitation.
And Allie, I see your question, and I will add that to my question and answer spreadsheet that I have about the fee-for-service and residential treatment access.
I'm going to respond to everybody with that so everybody can see Ellie's question, because I think that Ellie's not the only one that will be grappling with that. So if anybody else has any comments about that, I would encourage you to put them into the questions box. When you do put them in there, nobody else can see them except the organizers. So Katie, Christy, and...
Oh, I didn't realize that. Sorry.
Yep.
Yeah.
Okay. And I didn't change my name. I'm Oliver Vera today. And so, yeah, I think that's definitely something to look at, is making sure that we are, and Amanda, that was part of your discussion last time, is what questions do we need to be asking to make sure we are taking into consideration that inpatient population who will get an enrollment lock. So I know it's something you're looking at. So any comments that anybody would like to put in here about that enrollment lock and how it would be impacted if somebody is either on a CCO or on open card, or would there be any possibility of having a choice depending on what their needs are? Or do we want to?
It would follow.
Go ahead.
Well, it would follow the same rules that exist now. So if they're dual eligible, Medicaid, Medicare eligible, they have a choice. If they're tribal enrolled, they have a choice. If it is an access to care, so the comment about the CCO being the barrier to residential access, so we know that provider capacity is an issue, period, across the board. There is just, people need more help than what is currently out there. So the question for me then becomes, is it that the CCO is choosing not to contract with providers, but providers exist in the community? Or is it that there is no provider capacity in the community for CCOs to contract with, at which time being open card wouldn't make a difference, right? There's nobody, there are no beds. If it's a matter of CCOs not contracting with providers to meet the network needs, that's something that OHA needs to be aware of and take some active steps to mediate with the CCOs.
Would it make sense to create a session to discuss with our community partners specifically this enrollment lock concept and what barriers we might foresee under different circumstances so that we can walk into it, we as an agency, making sure we know what considerations need to be held in that space?
I certainly think so. Yeah.
Okay, so let's keep that. I'll make a note of that, and we can use this as a prompt to discuss that and how to further explore it. Sound good? And we'll discuss that offline to go deeper and see how we can create more discussion and make sure that we're asking all the right questions.
And it appears we have a few more minutes, and I just have one more slide that we can go to.
Thank you.
And this is the proposed timeline. This is our ideal timeline. We are now in the phase of trying to discuss how to design the change request to allow for next day enrollment, go from weekly cycle to next day. And then discussing how and when we're going to begin the rulemaking process. And it's very limited. It's just a change from, we're not going to be changing all kinds of rules, just changing the weekly enrollment cycle piece of things. And ideally, leadership wants us to implement it by January 2024. And the solution is dependent on what we find during the design testing. It could be next day, it could be next business day, or it could be next business day, depending on if we can improve our limitations in the next year or so. But yes, we want to implement this speeding up the enrollment by January 2024.
Thank you.
Mm-hmm.
All right. Are there any additional, thank you, Amanda and Katie. What we're really showing here, what we really wanted to do is make sure that you, as our Justice Involved Assisters, know about some of the inner workings and what we are moving toward. So even though these are not happening now, we know that you're deeply involved in this work, and we wanted to let you know what is on the horizon and have a chance to think about how that will impact your community members that you're helping. And your questions also help us know things we should be looking at. For example, making sure, and it is on our radar, but really making sure that we are exploring the enrollment lock and how that impacts folks and any unintended consequences, and so that we can try to head those off. Knowing that any given situation may benefit some and not benefit others, we're trying to go for the overall best situation. I think it's it's a useful discussion. So thank you for bringing it up. I've made a note to look at it with Katie and to further discuss it. All right, so with that, can we go into a last topic for our last few minutes? Amanda, do you have anything else?
I do not.
Okay.
That's it for me. Thank you.
Thank you. Then for our last few minutes, and I don't have a slide, so I'm just going to stop sharing the screen and just move to discussion here. But I wanted to make sure that everybody has gotten the memo, first of all, that you are now able to send in 7100s and new applications up to 30 days prior to release, as long as you then keep the Justice Involved team updated with any changes to that release date. So I would like to ask folks in the chat, in the questions box, can you please let us know if you're using that or not? A yes or a no would be sufficient to start with. If you are using it, I would like some feedback about how it's working. Is it working well? I see yes with some exclamation points, so I'm guessing that one's working well. But is there any feedback that we need to hear about? Love it, it's so helpful. Excellent. If you're not using it, any other comments about whether it's working well or not, or if there's anything that's not working as you would hope. Okay. Working great. Excellent. Okay, now here's what I'd like to ask you. If you're not using that, if you're not sending in your applications 30 days prior to release, can you tell me why? Is it because you didn't know about it? You haven't adjusted your processes yet? Or something about it isn't working for you? Or doesn't work for how you operate or your workflow? So if you can give me a little bit of a read in the questions box, that would be great. And I know not everybody can see these answers. So I apologize that you can't all see the answers, but we want to know why people aren't using it. And the reason this came up is because in a survey that we sent out to Justice Involved Assisters, we found that many of you are not using that permission. And so we want to make sure that we are asking the right questions. Somebody has not needed to do it. Oregon State Hospital starts the process and I don't always have a heads up, okay? Love turning it early, but some seem to not be processed until well after release. Thank you. That was from DOC. We can look into that. Or if you want to say more about it. We will be using the 7100 again once you're re-certified, okay? Not doing much enrollment these days. Okay, so I haven't had the jail I work with allow us the information. So Vixen, maybe if you can say more about that. I think the point here is we want to be sure that you know that it's a possibility and that if you want to do it, that we are supporting you and helping you in any ways that you want so that you can utilize that permission if it is useful. So please reach out to us. Let us know. You're welcome to reach out to me, Deanna Simon, directly. Let me know if you have any questions about that or would like any support on that. And Jerry, I do see the note about recertification. We don't have a training for justice involved individuals. We just note that you're a justice involved assister in our system. So if you haven't taken the training for justice involved, don't worry about it. You do need to be an active assister, however. So I think with that, we are at time. I want to thank everybody for being here, for listening, for asking questions, and for all the work that you do. And thank you to Christy and Katie and Amanda for sharing some updates on our programs to keep people informed. So thanks everybody and have a wonderful Tuesday. And I'm going to end the webinar. Ciao.